It is great to see everybody here today for the Community Health Assessment unveiling. Uh, it is, it's one of the things that, and I mentioned this 3 years ago when we did this, and 31 years ago when I got in public health. The one thing that I've always liked about public health is when the public comes together and people come together to not only hear what's happening in the community, but help solve the problems. And seeing this room as packed as it is, it's what gives me hope every day that I come to work. So that's me, if you couldn't tell by the picture. So I'm Mark Adams, if we haven't met yet, the health commissioner. And just what we're going to be talking about today is we're going to go over the community health assessment. We're going to go over the data piece. Now, you might remember 3 years ago, if you were here and we talked about it, the health department made a commitment, and that commitment was putting together a data team, because it's kind of hard to move forward without really being able to dig in to the data and having the appropriate number of people to be able to do that. And so that we did. We set forth that team and put that team together to be able to go over everything that we're going to go over today. We're going to talk about the 2023-25 CHIP outcomes. Next steps. So what are we going to do with this information once we have the community health assessment? It's one of the, when we look at the child and we look at the CHIP, one of the two most important health documents that exist in every county. And we embarked on that mission, all of us here, not only talking about it, but listening and changing the way that we do things in the community based on these documents. So we're going to be able to go over that and say, okay, to build on what we've done, where are we going to go next? And then have some time for Q&A. So we want to thank you to everybody that's out there, especially with our Community Health Improvement Plan Steering Committee, Cleveland Clinic, Avon Hospital, Lorain County Health and Dentistry, the Metro Parks, Mental Health Addiction Recovery Services Board, Lorain County, Mercy Health Allen Hospital, Mercy Health Lorain Hospital, University Hospitals Elyria Medical Center. We were financial support from Lorain County Health and Dentistry, Mercy Health, University Hospitals. I also put envelopes at everybody's table if they want to. No. Collaboration and data sharing from Moxley Public Health and Save Our Children. Thank you to everybody. And also the CHIP subcommittee members. This is an all-inclusive effort. This cannot move forward without none of this. Nobody can make it better unless we work together. And the conversations that I heard this morning, I was talking with Ben at Lorain County Health and Dentistry, and it's something that I've heard over and over again is Lorain County is filled with people that want to do good work, that want to make it better for people in the community, and that want to make a difference. And that's these people here listed, and also just so many more people in the community. So our community health assessment, if you haven't heard this before, this is an obligatory slide, but just as a reminder, it's something that's legally required. We have to put this together. And it's something that I've told the staff and something I've said for years. I cannot stand a rubber stamp document or a document that you're required to do and you do nothing with. I hate that. And so it's, I haven't been here forever, but it was something I wanted to make sure that, and I don't speak for anything in the past, I only speak for while I'm here, is that whatever we do, is that if we're going to take this document, we're just not going to publish it and not do anything with it. We've done something with it, and we see that everybody else out there is doing something with it as well. All that data that's driving it as well. That's the one thing we learn in public health, is what drives what it is that we do, and data drives that. It's everything that we do. Data says this is what we should be doing. That it's mandated not only for hospitals, mandated in the Affordable Care Act, but by state law for health departments to be able to put this together. That it be transparent, that everybody get to see it, everybody get to hear about it. And that was one of the things that there are personal goals that we have at work, and one of them was, my personal goal was to make sure taking the community health assessment into the community. And just as a side note, I tracked how many people I was trying to talk to about it. Everybody got the same speech. It was hundreds of people. I made sure every student, anybody, it was, whether I was at Lorain County Metropolitan Housing and talking with residents, they got the same speech. I want to make sure everybody, at least that was one of my goals. And it's about collaboration, and this is clearly about collaboration. All of you in the room are about that collaboration. It identifies the key health needs and issues through systematic comprehensive data collection and analysis. The collection is best when gathered through proactive, broad, diverse manners. And data and the transparency make it the starting point for the community health improvement plan. So we do the CHA, and then we come up with the CHIP and say, okay, we've got the data. How are we going to fix what's wrong? The primary data we went through 6 focus groups, 21 stakeholder interviews, both in partnership with Mercy Health, women's health assessment, survey conducted by LCPH with women of childbearing age plus fathers of young children, and then secondary data sources such as the Ohio Department of Health, Epicenter, Health Monitoring System, CDC, Healthy Northeast Ohio. And so just, you'll be able to read it up there, but just an idea of what we got back in that. So that was one of the important pieces of a community health assessment, is publishing what people were saying. Problems with transportation still. Problems that they just still can't make ends meet. They might, in some cases, they might have access to healthcare, but they can't get to it. So they might be able to have the health insurance, but they can't get to the doctor's office. So those problems still exist. A lot of people this time around, so the last time the community health assessment, you saw problems with I can't pay my rent, or somebody saying, I want doctors to look like me or talk my language. We still have a lot of that, but also at the same time, I feel like now I'm spinning my wheels. I can't get caught up. Times might seem better to some, but it's actually getting worse in some cases financially for a lot more. So the social determinants of health piece, it's rare for a community health assessment to come out and say, here's the problem. And that's exactly what this community health assessment has done, is it comes out and says, what's the problem? When you look at the social determinants of health, no community succeeds with one of the spokes in the wheel missing. And the 5 spokes here. If you don't have good jobs, if you don't have the good hospitals, if you don't have good schools, if you don't have good neighborhoods, if you don't have good social and community context, any one of those things missing, eventually your neighborhood will fail. Your community will fail. If you just, for example, you take out jobs, that's less of a tax base. That's less money that a person can use to fix their home. That's less money that goes to the schools. That's less money that goes to any tax-based, if you want to help with a library or any type of social community context, taking care of parks, anything. That's less money. Any one of those things missing. You can't build upon a community without having good schools. You can't build upon a community without having good hospitals. You can't do that. And so that is where we see our problems sometimes in the community, is sometimes one of these things are missing. So we highlighted this SDOH data points that are impacting Lorain County, and that social determinants of health has an influence on disease and condition prevalence and outcomes. So what I want to bring up is, since data is such an integral part in what it is that we're doing, I need to bring up Mitch, our data lead, our supervising epidemiologist, and one of, I like to call a little bit of a dream team when it comes to data. So Mitch, if you could come up, please.
Hey everyone, I think this is my 3rd time doing this now. I've been with Lorain County Public Health for 10 years now in January. So it's kind of exciting just to kind of go through this again, just to see the differences, what happens each cycle. Here's just a key findings by health outcome area. These are the main areas that see a lot of investment with our CHIP Community Health Improvement Plan priority teams. A lot of initiatives are driven around these particular areas. But I'll get more into the data a little bit, but there's these key findings sections in the document itself, if you want a good summary of what might be different from last assessment. But this is our first health assessment since the pandemic ended, meaning I know we did have a community health assessment in 2022, but the data was only updated through 2020 in that document. Here we actually are starting to see the years following the pandemic. So we're able to see some of the fallout, how that really impacted our county in terms of some of these outcomes. But this is just an overall death rate. This is from the Ohio Department of Health, Bureau of Vital Statistics, death certificates. In 2021, we had over 4,000 deaths. Our county's never seen that before. We do see a lot of people moving into that 80 and older age group. So we do anticipate the number of deaths increasing every year for the most part outside of the pandemic. So it's really important to follow that rate, that age-adjusted rate, that blue line at the top, to really see, are people dying younger of different causes that would really influence that main outcome. So in the past 2 years, we've seen it. We've seen it dip from the all-time high in 2021. In 2021, COVID obviously was going on, but we also did see a lot of drug overdose deaths that year. So it's just a very inflated year. So I'm going to go over some of the key priorities against those areas that see a lot of investment with time and resources and conversation, and just try to bring some new insights and just some updates on what the county looks like now. The overall infant mortality rate, we see roughly 20 infant deaths a year. We average that out in 5-year increments in order to identify some trends. We remain about 6 infant deaths per 1,000 live births. It's been that way for about 10 years. Looking at it at a demographic, racial, ethnic demographics, you can see where the disparities really can be highlighted. Some trends there. From 2014 to 2018, we averaged about a little over 3 deaths per year amongst non-Hispanic Black mothers. The last 5 years has been over 4, so that's going in the wrong direction. That's up to 14.5 infant deaths per 1,000 live births. So almost over triple that of white non-Hispanic, and then almost over double of just Hispanic infant mortality. And that's filtered by the race of mother as well. A major driver of infant mortality is preterm birth. Extreme prematurity accounts for about 33% of our infant deaths, which is the #1 cause. Conditions of the perinatal period and prematurity combined are about half of infant deaths, followed by some safe sleep and some other outcomes. But preterm birth rates year over year are still increasing. We're over more than 1 in every 10 births in our county are now preterm consistently for the past 5 years. We did look at induction because induction is a big piece with blood pressure. The last 5 years, about 25% of those preterm births were induced. If you take out induced births, that trend is still continuing the wrong direction. So that is still, preterm birth rate is still increasing, even controlling for that outcome. And then again, looking at the disparities a little bit more, you can look at the extreme preterm and very preterm. That's the very vulnerable area when infants are born within that 28, less than 28 weeks to up to 31 weeks. And non-Hispanic Black mothers are also way overrepresented in those very vulnerable areas. Looking at some of the work that we've done regarding preterm birth, there has been a lot of effort in changing behaviors of pregnant mothers, seeking care, substance use. So we've actually made some really great progress. Smoking tobacco while pregnant has gone from almost 17% 5 years ago, down to 10%. Smoking is associated within our county to a 31% increased risk for preterm birth. So you're trying to imagine our preterm births going up and we're still improving some of these areas. It still probably could have been much worse had we not made some progress, because inadequate prenatal care has also gone down from 16% of live births to 14%. And those who received inadequate prenatal care had over 3 times the risk for preterm birth. So there's been some improvements in those health behavior aspects. But when we start to look at the health of the mother, either going into the pregnancy or once pregnancy started, this is where we get into some of those drivers of preterm birth that are a little less straightforward, and probably a little bit more complex to address. Gestational hypertension has doubled within the last 10 years. Pre-pregnancy hypertension has doubled within the last 10 years. Those are associated with over 2.5 times the risk of having a preterm birth. Same with gestational diabetes. Those outcomes are also going up. Those risk factors are also going up throughout time. A lot of this has to do with the age of the mother. The average age of our mothers are moving up toward that 30 range. Obesity amongst women of childbearing age in our county is also going up. So trying to work against some of those factors that are associated with preterm birth. Moving into behavioral health. I've been tracking death by suicide rate for a while now, and it has always been going up. So that has also flattened a little bit, leveled off. Still too high. We see almost about 50 suicide deaths per year. But the rate itself has leveled off, which is better than it going up, obviously. We see large progress in that under 20 age group. In a 5-year increment, we had 10 deaths by suicide within that age group versus 15 the prior 5 years. Also progress made in that 50 to 59 range, 60 deaths by suicide 10 years ago, and now down to 43. Still, it's 4 times higher amongst males than females. But also, we have some access to other behavioral health data through our ERs. They classify their reason for visits, and we're able to pull those. And what we did is we looked at self-harm ICD-10 codes along with suicide ideation. So the reason for visit was some sort of self-harm or suicide ideation reasoning. What kind of stands out here is how elevated those are in the 10, those 2 younger age groups, those 10 to 14 and the 15 to 19 years. So in 2024 alone, there was over 600 ER visits for self-harm amongst teenagers. Female rates much higher than male rates down in those teenage years. But as the rates decrease, as you get older throughout life, the rate of visits actually switches higher in males than females, which we thought was an interesting trend. Another thing to kind of look at with these graphs are they're all trending in the wrong direction in terms of overall numbers and rates. Sticking with behavioral health and drug overdose, our 5-year rate has increased, but recently we've seen a significant drop. I know this is only done through 2023, but I can tell you in 2024, those drug overdose deaths are going to be even lower than that 119 seen in 2023. So recent success after that pretty drastic period in 2020 and 2021. In 2021, our fentanyl deaths were at an all-time high at 119. So fentanyl deaths really are the driver of this rate for the majority of the time. In 2023, we had 97 fentanyl deaths. So clear association when you address the fentanyl, the death rates come down. And a little bit of an evaluation. I know there's a lot of conversation, a lot of initiatives about Narcan being more available at the street level, high-risk neighborhoods. A lot of work has been done in that. This graph's a little bit difficult to see, but it'd be the one on your right. This is taken from OD Maps data, which is first responders. When first responders respond to a call, they will log it in their phone. If it's a drug overdose, and it'll say the type and where the location was. And it's kind of a live feed. So looking at emergency responses, police and EMS responses, and some fire departments as well. The overall numbers of responses in 2022 was 607. That's all the way down to 283 in 2024. So a threefold decrease in 3 years just with the number of responses. It doesn't track the number of overdoses occurring in our county as well, but it is the responses. So it is a measure of burden on the healthcare system or the first responder system as well. That blue line, if you see in 2022, it says 59%. So over half of the responses, a first responder was the first to give Narcan to the victim. All the way in 2024, that's down to 22%. And what's driving that is the large increase in bystander administration. So I spoke a little bit about those street initiatives, getting the Narcan available. If you get it in the right hands to the right people in the high-risk neighborhoods, they are right there on the scene before the first responders get there. And we're almost at 30% of the responses now are administered by a bystander before the EMS even get there, which is a lot of success with fatality. Obviously, the quicker you respond, the likelihood of survival increases as well. So in 2022, 10% of the responses were fatal, and now down to 2%. So it just shows that correlation when you have Narcan in the right area, administered by bystanders, less calls and less fatalities as well. So some success has been seen there. And then just quickly, some chronic disease outcomes. This is a trend that has changed recently, that is, of heart disease, age-adjusted death rate. That's been decreasing for decades. And within the last few years, that has actually gone up. You can see the overall number of heart disease deaths up over 750 per year for our county. And then I have that purple graph next to it that shows the national trend as well. So it's not unique to Lorain County, but it is very significant in the sense that we've seen heart disease going down forever, and now it reversed as of recent. When we look really down into our age groups, female age 55 to 64, much too young to be having a heart attack, is up from 102 to 111. Males within that same age demographic, 250 to 279, and then a very large increase in age 65 to 74 amongst males, which is 456 5 years ago, which is now at 562. So you see those younger age groups, those rates going the wrong way. That's causing the age-adjusted rate to go up as well. Diabetes, we included this one on here. It had a little bit of a unique pattern. We had a very low number of diabetes deaths, relatively speaking, in 2023, down to 85 after we've been around 100 for the last 5-6 years. Some improvements in rates among non-Hispanic Black population and the Hispanic population. Just an interesting trend to follow. Cancer, again, like I was saying, this is kind of our first look at data post-pandemic, be able to wrap things up a little bit on how that affected what we've noticed. And again, this is not unique to Lorain County either, is the number of newly diagnosed cancer cases fell dramatically during that first year of shutdown, meaning plenty of cases probably got missed. So just looking at overall counts of new cases, you could see we were well above. Males are the darker line and females are the lighter line. That top graph is all types of cancer. So just looking at it broadly, you can kind of see that dip for both sexes. It was more pronounced when we looked at it by type in males and females, especially with prostate cancer. Prostate cancer is one of those cancers we anticipate to go up every year because age is the driver there. So the overall prostate cancer cases should be increasing, at least flattening out year to year. And it went down significantly in 2020, and you can kind of see how it's being made up now. Female breast cancer did not follow that trend. They actually went up in diagnosis during the pandemic. So not a sociologist or psychologist. I don't know why this happened. But females seem to be meeting their screening requirements maybe a little bit more during those times. And you can really see the difference with the colon and rectal cancer cases, that the males being that darker line, the females being that lighter line. They did an inverse in 2020 where you see that new cancer cases or colon cancer cases in men significantly dropped during the pandemic. So that's an interesting trend, something to always keep in mind. And then other relevant findings, especially with the pandemic, when they went virtual for school, I think, well, the data shows that we've lost a lot of ground there. So this is going to be something that affects, obviously, education affects your health later in life, where you're at in terms of education. So this is something that we wanted to monitor, put on the radar now, that kindergarten readiness, that top graph has gone down, both in the state and in Lorain County. So again, this is not unique to us, but looking at fourth grade proficiency, math proficiency, we were above 70% for a long time. And in 2020 went down to 56% proficient in math for fourth graders. That has still yet to recover to above that 70 percentile. Same, you see the trend with language arts and English as well. And then eighth grade proficiency, again, with that large drop in math, where we were over 60% in math proficiency in eighth graders for a long time, and that went down to 40 in 2020 and is yet to reach 50%. So just some things to try to understand how this will affect health later in life. So the results of the pandemic are kind of being seen. And then we just wanted to show these features that we have, some new features of we're always trying to evolve this document to bring out some new insights, bring more information, especially if people are writing grants at the local level. We want this to be helpful with that. So what we have done is we have separated the cities. We've combined some of the townships for population reasons, and then looked at each individually to see how health just changes where you live in our county. I know there's a lot of rural areas, a lot of suburbs, and then obviously the two urban areas. So what we did was we created maps with some of what we call assets and resources, and then it'll be accompanied by their health outcomes. Now, this isn't North Ridgeville, but this is the southern townships. I think this is maybe a combination of 4 or 5 townships. I don't know off the top of my head. But you're able to see their health outcomes, their birth outcomes, and their health outcomes. This is pregnancy and birth outcomes graph, but there's also mortality statistics for each region as well, where they're at compared to the county rates. So you can kind of see how different things are affecting different areas. Or if you're just wanting to know a stat for a particular city or a particular area, you should be able to pull that relatively easily. And then trying to compare the areas with one another, just to show how different areas are changing. Obviously, I don't think this is news to anyone, but North Ridgeville is exploding with population. It's gone up almost 20% in 10 years, which is huge. And then Avon as well. And then some of those areas that are losing population, Sheffield Lake, Elyria City, some of the townships like Carlisle Township and Brown Helm Township, and then some of the other rural areas are losing population. Lorain County population increased by 4% in 10 years, which is pretty high, actually. And then I'm going to move to Erin. She's going to talk a little bit more about some of the inputs and why the data might be what it is. Doesn't work.
Oh, okay. Good morning, everyone. I'm Erin Murphy. I'm the Director of Population Health at Lorain County Public Health. So now that we've seen and heard about some key data points from this year's CHA, it's time to turn our attention to where the real work begins. So we kind of joke that the assessment is the easy part. It's the work that comes after that can be a lot more difficult, but arguably is probably more important. So we've identified where we need to improve, and what do we need and what will it take to get us there? How will we work together? Lots of people in this room that we recognize from our partners, to move the needle on some of these key issues that we know, that we've seen, that Mitch told us are impacting the quality of life for our county residents. But before I jump ahead into 2026 through 2028, which is the next cycle that we're kind of prepping for, I did want to review some outcomes from our last community health improvement plan, which ran 2023 and will run through the end of this year. So this was the action plan from our last cycle, and we do have a few outcomes and progress that you can see on the screen here. Of course, our last implementation plan was drafted in 2022. We were coming off the heels of the COVID pandemic and vaccine rollout, which was undoubtedly probably some of the most trying years for our agency, and many of your agencies as well, and the field of public health in general. But we knew there was work to be done, so we did not slack off on trying to put together a plan back in 2022 because we knew we needed to get back to business and start serving and supporting the overall health of Lorain County after coming up for air from that pandemic response. The COVID pandemic didn't teach us about the strength of partnerships in the county. We knew those existed, but I think it really emphasized how well we came together and worked on the COVID response aspects. And so knowing those strengths of the community, we did make a commitment back in 2022 to build upon them and continue working together towards common goals that were not giving people COVID vaccines or running through the COVID pandemic steps. We updated our CHIP subcommittee model during the last cycle. So the subcommittees were mentioned here, some of the partners on there. And we put significant emphasis on data to use it to guide decisions along the way. And every CHIP subcommittee over the past couple of years has started with a look at its associated metrics. And that's really important to us because we need to know, should we keep going in this direction? Should we pivot? And these questions really guide the discussion and dialogue now in those groups. And we have kind of reframed the CHIP, or the Community Health Improvement Plan, as a living and breathing document, changing and updating as needed when we need it to serve the community in a different way. So as a result, the work of our partners on these committees has exceeded our expectations, has exceeded my expectations. And we don't have time to share out on all the progress today, but you can see some samples listed here from each subcommittee group. And then I'm going to walk you through one example, though, that's going to help illustrate how we've orchestrated the work over the past couple of years. So back in 2022, we started with our GHOST model. And that was what we used when we were developing the plan. So looking at this, we understand here that the goal is long-term. It's difficult to achieve quickly. It's influenced by many factors, not just the ones that the CHIP subcommittees or our partner groups or some of you all in your day-to-day job are working on. And the goals are directly informed by the community health assessment and the data points that Mitch just shared to you. The objective is something that's going to be more measurable, attainable, time constrained, and agreed upon by the partners. So remember that these cycles work in 3-year increments, which means every 3 years we kind of have an opportunity to revisit, reassess, maybe take a different direction. And so those objectives can change. The strategies are really like, so what are we actually going to do? These are agreed upon by the partners with community input, and then the tactics really represent the specific steps that we need to take and who's actually going to be doing those steps and doing the work. So again, talking about our last CHIP cycle that we're in the midst of right now, we see our chronic disease outcome example here, which was stopping the upward trend of diabetes diagnosis. and improve management of diabetes through both education and systems or environmental change. So let's take a look at our progress so far here. We're 2 years into this cycle. So in some happy news, we see that the El Tomando Diabetes Management Program at El Centro and the YMCA Diabetes Prevention Program, they set a goal back in 2022 to ensure that enrollment in those programs was increasing because they're evidence-based. We know that some of this works. And 2 years in, we've seen that they have surpassed their goal of increasing enrollment by 25%, and they've actually met or exceeded it with an increase of 85%. So that is good news there. On the outside of the education, access to care side of things, we look at a lot of systems and environmental changes, and we look at policy changes too that can influence our health. And so to give you an example of a diabetes-associated system and environmental change, potentially impacting the behavior of many people at a community level, not an individual level, we see here that we made a commitment with our partners to create livable communities, make it safer to walk, bike, get outside, go to a park, walk to school, and just really enjoy physical activity, the mental health benefits of being in a space like that. So this social determinant of health that is really getting impacted here is back to that neighborhood and built environment one that Mark talked about earlier. So other good news here. We see that we have a number of communities impacted by plans and policies has exceeded our goal within 2 years. A lot of this is driven by funding secured federally that will develop and has started developing countywide priorities for updated methods of transportation to support walking and biking, while also preventing deaths and injuries to anyone using Lorain County roads, including people who are driving, public transit, et cetera. So the number of plans that and policies that went into place, those are touching everybody in the county at this point. The number of communities reached through park improvements and improved green space has reached about 1/3 of the jurisdictions in Lorain County in the past 2 years. And I do want to put a disclaimer here. So note that these improvements are the ones that are provided to the CHIP subcommittee, and there are probably, most likely, more park and green space improvements happening around the county that we just don't necessarily know about or are not necessarily being reported in the CHIP subcommittee, or the partners of the subcommittee are not directly supporting, but that doesn't mean other people in the county are not supporting them. But we're almost there, so making some good headway in that regard. So now that we've seen the goals, the objectives, the strategies, we go back and we revisit the goal. So we say, okay, we said we were going to do these things. We're hoping it's going to impact diabetes, chronic disease. We just want to give everyone an opportunity, right, to prevent chronic disease, live their best life, all those good things. So these aren't evident of causation. So we're not saying like these specific things that these subcommittees did are leading to this specific change in data. However, it's part of a fabric. It's part of a partnership. It's part of all of the good things that people are doing either within or outside of the CHIP subcommittees, the CHIP plan. And really, I think just shows that we're working towards a common goal. Okay, so now that we kind of revisited the CHIP cycle we're currently in and gave you an update on some of our progress there, I want to turn our attention to the future. So the next CHIP cycle or CHIP implementation plan is going to represent strategies that we'll be trying to implement between 2026 and 2028. I wanted to put this quote up here. This was a direct quote from one of the focus groups that were conducted. And I just love when people are honest. This gentleman was like, yeah, you're taking notes and that's great, but what happens next? Like, what are you actually going to do? How am I going to get helped? How is my community going to be helped? And I want to make it clear that we know, Lorain County Public Health knows, that a health assessment that sits on a shelf without any action is worthless. And we've been working towards shared goals and strategies all along. I just highlighted one of those, and we'll continue to do so in this next cycle. We also know that Lorain County Public Health can't do this on our own. We have a great staff, we have a great team, but it takes an all hands on deck approach to build out the plan and then, most importantly, actually implement the plan. So in terms of next steps, we're looking at a rough timeline of this summer and into fall, where we have brainstormed some tactics among our team on where do we start. We think we'd like to conduct some additional engagement with partners, residents, and committee members now that we have the updated data as a guide by asking questions more like, why do you think this statistic is what it is? We have the data. This is what the data is telling us. Why do you think this is happening? And we hope to gain some additional insights from those conversations. We also are ready and willing to learn from our partners. What strategies have already worked for the population you serve? Can we expand on a good thing that's already happening? What are your counterparts in other parts of the state, other parts of the country doing? Can we learn from them? Can we apply what they're doing here? Where is there momentum, political will, and funding support, all crucial ingredients? And what is a reasonable workload for 3 years? Currently, there's over 30 strategies in our CHIP. We'd like to pare that down this time because we want to make sure that we can adequately and our partners can adequately focus time, energy, and resources on a few things that we believe will make a difference in this time frame. We've been working in conjunction with the healthcare systems in this county, and there is great, great power in that partnership. We hope to work together again with laser-focused attention on at least one common strategy we can all agree and share and work together on. So what is a commitment from Lorain County Public Health? We'll be working with the CHIP subcommittees continually throughout this year, wrap up this cycle with them, and we'll be including them as we plan strategy steps. We'll continue to leverage resources and find funding, which we do a lot. We like to find funding for other people. So we like to find funding for ourselves, but we really like to find funding for other people because there are so many people in this county who are doing the work and they're doing it better than we could do it. They've been doing it for longer. They have more of an expertise in that area, and we want to help. So we want to help use our capacity to help you do that. We'll take care of this blueprint, okay? We'll take care of the health improvement plan, and it will influence the decisions that Lorain County Public Health makes every day. That is a promise. And we will track progress and outcomes as closely as we're tracking them now, if not closer. We'll rely on partners as we've previously done, again, to help exercise their strengths in their areas of expertise. We trust them, and we want to help them, like I said, in any way that we can. And in addition to supporting the CHIP as a countywide plan, we will be dedicating, we're already dedicating time and effort to some current coalitions, maybe some locally based coalitions and collaboratives. And we intend to pilot team development in jurisdictions that may need some hyper-local support for place-based initiatives that will contribute to the overarching CHIP goals. So that is a direct tie-in to some of the hyper-local city, township, regional maps that Mitch showed you, because now we know at a community level, is something going on here that isn't going on in the community next door? And why is that? Let's dig into that a little bit more. The other thing we want to do is we really want to find new ways to engage grassroots, fledgling organizations in this work. Perhaps organizations we have not really formally worked with before, because we know they're out there. And we want to work with them. We want to find ways that we can align our goals and objectives together. So if any of this sounds good to you, which I hope it does, there's a few things you can do to kind of help us on this journey. You can communicate with us on recruiting participants for additional community engagement. You can host us to facilitate a discussion with a group you're already facilitating with some people you already know that would have really good insights in this space. Let us know, invite us, we're happy to come. Introduce us to an organization we are not familiar with. even if you're not sure, just tell us, because at least we'll know that, oh yeah, we know so-and-so, but sometimes we'll say, actually, we've never worked with them before. Can you make an introduction? Can you make a warm handoff for us? That would be great. Assisting with coalition alignment, working within the committees and coalitions and things that you're currently functioning on, to join us, bring alignment into the plan, help inform the plan with any data that you may be collecting specifically. Financially support CHIP strategies once determined. I told Mark I was going to shoot my shot. I'm just putting it out there. And importantly, if you can't do any of the stuff that's up there, and you just have enough bandwidth to focus on your organization, your cause, whatever you're doing, I'm okay with that. But use this data. This data is for you. This data is not for us. This data is not to send to our accreditation board. Use it. In addition to the health assessment document, we regularly post data briefs on various pertinent topics on our website. Use it for your grants. Use it for your strategy development. Use it to guide your decisions over, in whatever space you're in, because it's real, it's accurate, it's local. And you have a whole team of people that can help interpret some of it for you. We can come and talk about it with you. You can ask us to dig a little bit deeper into something, and we will try our best to do that. So use it, be familiar with it, and make it your friend as you are trying to, again, find funding or guide decisions in your own organization. So that is it, you guys. We weren't going to keep you here very long, and that was a lot of information. So there are note cards available on your table. If you have a thought or a question that you want to jot down for us to collect at the end, please do that. The community health assessment can be found through the QR code that's on your flyer in front of you, or at loraincountyhealth.com/CHA. Email us or call us for follow-up. The speaker's email addresses are here. That's our main office line. And we're happy to connect with you after this presentation in whatever way you would like. But we will also turn into some Q&A now if anyone has questions they'd like to ask in front of the class. And I don't know, could I have one of my runners? I think I can use this if someone needs it. Reactions, concerns. Okay, gentleman over there.
So great work, very impressed with Mitch, one Mitch, one David. So those who are not epidemiologists understand it's great.
Yeah.
Clearly, with changes, government level, executive orders, none of us know what that's going to look like. But as we go through this next cycle, do we want to put in some sort of influence that meetings, et cetera, to say, we're suspecting that this is going to really impact this population of people. How can we come together as a community with your support? Is that something that you want to make?
I told Margaret I was going to get them to go into the question.
We weren't sure if the financial question would be the first question. Each one of us probably are involved with some organization. We have two that are in public health, well, there are 5 major organizations, but there are also some specific organizations. We have a Ohio Environmental Health Association and Association of Ohio Health Commissioners. Even last night got a call about when it comes to the state budget, there are going to be some cuts of that, and that ends up, that was a warning that, hey, by the way, each health department is going to end up getting different cuts. It's really to work through those organizations. A lot of times, and when I was in a service, you're looking at things on the very large federal budget. You don't know everything that happens on line item 410. So when you're looking at trying to balance something, you say, I'm going to cut 410 out of it. And the only way that you let somebody know that item 410 was important, and I don't mean that there's no bill at 410 or anything like that. I'm going by item 410. Page 6, third one down, is by letting them know what that line item does. It's through your organizations. And letting elected officials know that, hey, this item, if we could keep this, if we could do this, If there's, that's what the importance of this item does. So it is, you know, when I mentioned in the beginning, you had this very important document that almost nobody really knows about. And some really, and even as Erin mentioned it as well, by talking about what this information is, what it does, it's a realism. It's not something that we pulled out of information from a document somewhere else in another state. This is our data. This is what's happening in Lorain County. And each county is going to have very similar data as well. And so just by letting them know, hey, if there's, this is important, if you could look at this line item and maybe, is there another cut that could be made somewhere else? Or, and I get that part. It's just that we have to advocate through those organizations as much as possible. And again, if there are residents that don't know what the community health assessment is or community health improvement plan is, there are surely people that are making those decisions at other levels that don't know what they are as well. And it's really just about informing and talking as much as possible and letting people know. So it's, even with those things that are happening, the health department's public health is, we're really still required to look at this and say, we have to adapt to this document because this is what's wrong in the community. So we have to figure out a way to make that happen regardless of what happens anywhere else.
Dr. Sark, were you also referring to like prioritization of strategies?
Yeah.
So if, sure. So like if a certain population we know is potentially losing funding, how can we kind of like rally and use that in our prioritization process? Yes, I do think that's important. Unfortunately, I have heard some rumors about some of the long established community health worker, home visitor, maternal child health focused programs. It's going to be important to keep things like that going. Mitch just showed us that we've seen some leveling off over the past few years where we've really built that workforce up in the county. So what are we going to do to make sure that momentum doesn't stop? So yes, I think absolutely that's going to be an important conversation as we move through the next few months. So thank you for bringing that up.
Great presentation. I'm going to stay on that main program that Dr. Stark talked about who might see impacted by these orders. I know we talked a lot about rebate Medicaid expansion that's been in place for many, many years. You know, we've had some really good results within our community around overdoses. Unfortunately, some of our legislators didn't want to see that downward trend and say, the problem's fixed, let's move on to the next thing. But you saw what happened with coronary artery disease. You know, now this is what's going on. So we have to maintain that status. But for us, I think what we would see if the rebate Medicaid expansion or any version of it, there's a particular subset of the population that we are really unserved, which is the substance use disorder addiction population. And we are closely looking at to make sure that if there are adjustments to that type of funding, how do we redirect resources to ensure that we minimize the impact there? We're working not only with our partners in the agency, but our colleagues with health issues, service support over there. So that is getting the second thing that, you know, there are well over 100 advocates in here that can write letters to your legislators about the Medicaid rates, about the impact of rebate. And it's not just taking away health care, we have an economic impact as well. The last thing I'll say is, and just a plug, the Lorain County Recovery, the Lorain County Crisis Recovery Center is opening in October, and it's going to be a place to offer 24/7 emergence and urgent both mental health and substance use disorder care. And I look forward to working with your team to make sure that we are including statistics from that facility as well. That is a partnership between mental health district, our services support, and good job. So we'll continue to make a positive impact.
Love it. We love all the data we can get. Thank you.
Again, in Lorain, Ohio, on May the 10th, at Lakeview Park. It's called Move with Mayor. So we walked around Lakeview Park a couple times. It's in conjunction with the National Forum to Prevent Heart Disease and Stroke Prevention. So I invite all of you to, you all do something. Instead of just using the data that we have, join me in walking around Lakeview Park and encouraging people to get out there and be healthy. So May 10th, 9 o'clock, Lakeview Park.
Mayor Bradley, why don't you challenge your other county mayors to competition, see if we can vote?
Yeah.
I'd like to say that. We're doing pickleball 2 weeks after that. Pull my hamstring or something like that. Yeah, I would challenge all of you to do something similar, where we get people out there in our communities to walk and y'all do something.
Thank you. And thanks for supporting that. Walking the walk, literally, is very important, especially when it comes from leadership in communities. So that's very good. Thank you.
So the government health that made and something big,
I think the county health department for taking the leadership in this community health assessment. One of the things that we've seen over at the commissioner level that we try to examine is that there's a lot of competition between agencies concerned. Taxpayers have been very generous. There's an enormous amount of agencies funded by tax dollars that have been voted in, which is a positive sign. And so at the end of the day, we started to look at some things, and the unfortunate trend that we find is that, and we're incomplete yet, so it's a little dangerous territory to share. We're the top 10 counties in the state for dollar resources devoted to public health in terms of mental health, drug addiction, and so forth. But we are in the bottom 10 in terms of success. While it's nice to see that our trend is down, compared to our peers, we're still high. We should be asking ourselves, how do we get to the head of the class? And one of the data trends that you guys did a terrific job hanging out. It's an old habit that died hard. Is that we don't find agencies asking, collecting, and analyzing enough data. And it's not just enough to write checks and say, we did well, look at this, we're having, we think we're making a difference. When we deal with a reduction in government resources, federal level to the state level, to our level, and we become more self-sufficient, we're going to need to be able to coagulate good data for everybody and find a comprehensive, efficient way of making improvement. And it's a big task, but it starts with the data. And I think the thing I take away from today is you're working on the data, and I'm sure we can fine tune, but we need others to do their data and coagulate it in a way that we can truly do it community plans. Thank you for leading the way.
Absolutely. Thanks, Commissioner. And I think I might even said in the beginning, even 3 years ago, when we talk about Lorain County is one of those counties that it's the perfect size. It's the one that it's got lots of partners, people that want to work together. The competition piece isn't there. Everybody. So we have these, Ben said it, symbiotic. So I'm going to steal it from him. That's exactly what we do in here. And when you look at the resources overall, yeah, so we have really good outcomes in Ohio. Did you happen to see the report, though, when it comes to public health spending across the United States, where Ohio sits, 4th from the bottom of all other states? Washington, D.C. is the highest with $360 per citizen spent. Ohio is 4th. So with little resources that we actually do, public health does get, or even infrastructure gets, and everybody gets here, we do really good things with it. And it's so that is excellent point. And with that data piece, that's why we made that promise 3 years ago to say we'll put the finance piece forth to create that data team to be able to say, and we've had lots of people use it too. When it was offered earlier, I think Mitch had mentioned it, where outside sources have asked us, we've had townships call us and say, hey, what's my cancer data in my township? Is this business causing any issue? Because I've had complaints. And so we've been able to send that over to our data team and then run a report and be able to let us know, do we have anything that's higher incidence or not higher incidence? So it is being used. We want it to be used quite a lot more and to gather as much data as possible, because fine tuning it helps us fine tune what it is that we need to do when we come up with strategies and tactics. Thank you.
I will just add too, so in the community health assessment document, just so you all know, we do have a page that links to a lot of the other assessments that have been done in the county over the past couple of years. So Lorain County's strategic plan is linked in there. The older adult specific assessment is in there. And really that was us kind of coming forward and saying, like, we agree. There's different data happening, being gathered in different places. How are we kind of coming together and putting it all together? And I think that, to Mark's point, the county, like he said, is ripe for that in terms of the size and the relationships we've built among partners. We just have to kind of, dig in and do the work as we've been doing the past few years. But yeah, thank you for bringing that up. Anybody else? Thanks, Jim. I hope.
Case cancer facility working with the Lorain. We are on the cusp. Earlier this morning with our legal counsel of business in the final work today, but through starting here hopefully shortly, we're going to have a number of for the country that will be available for Lakeview, a number of places along the park, the lake, water golf courses. So we talk about appeals for, 7 days around, we had partnering with Clifton Clinic, as well as UAs and UAs as well, and Case Western University and facility. So, just want to take this opportunity to talk about that and work, promote it. Obviously, very important to everybody involved, so thank you.
All right, if something came to mind and you would like to jot down either a question or a comment, please do that on the note cards on your table. If you want us to contact you back, please write down a way for us to do that. But thank you all for attending, and I'm going to hand it over to Kiana.
Good morning. I think it's still morning. Yeah. Good morning. My name is Kiana McIntosh Farms. I oversee the wraparound resources here at Lorain County Community College. And I just wanted to say on behalf of LCCC, this room is full of a number of influential individuals. And so you all are proving that collaboration works. And I'm going to ask, that the same thing that Mayor of Lorain, Mayor Bradley. Yes, the 2 B's, man, I tell you. But Mayor Bradley, he's exemplifying walking the walk. And so put your things into action, the things that you talked about, the things that you thought about, the information, the phenomenal information that the Lorain County Health Board provided you. Put those things together, empower your constituents, and do some things. Walk the walk. So on behalf of Lorain County Community College, Dr. Marsha Ballinger, and all of its executives, staff, faculty, we appreciate you being here, and we thank you for the things that you will do after this meeting.